Hey, thank you, Maya, and thank you to all of our panelists for helping us to understand the critical role compliance has in fostering trust. As we move on to the next session, don't forget to share your feedback by scanning the QR code on the screen. And as you do, I wanted to just highlight a couple of points from that session that really stood out to me. Clearly, putting patients at the center is critical and vital for the direction that we're going in as a healthcare industry around access and equity. I was particularly taken by the points around transparency as a way of really bundling together all the actions that organizations can take in addressing patient groups, medical associations, and industry associations, and how to have the moral compass that leaders have to guide what compliance can do, as opposed to the other way around of becoming a rules-based operation and organization. So at this point, I'd like to lead into our next panel, which is titled Health in Your Pocket, Leveraging Digital Solutions to Empower Community-Centered and Patient-Centric Care Models. Our panelists have now made their way to the stage, but just as a reminder, don't forget to use to submit your questions, and our moderator will be able to get to those throughout the session. We've had some great questions so far, so keep those ideas coming. So now let me pass the stage to Daniel Laverick, Senior Vice President and Head of Digital and Data at Zuellig Pharma.
Thank you so much. It's my pleasure to be here. I'm joined by a very esteemed panel today. Sitting next to me I have Julian Sham, Healthcare Lead, Asia Pacific and Japan for Amazon Web Services. Julian brings with him more than 33 years of experience in healthcare, including 10 years as a practitioner hospital doctor, 22 years managing healthcare projects involving IT implementations, clinical transformations across Europe, the United States, Asia Pacific for both public sector and private organizations. Welcome. Next, Snehal Patel, co-founder of MyDoc. Snehal is the managing director of Snehal Partners, an incubation firm based in Singapore. In that capacity, he most recently served as co-founder of MyDoc, Southeast Asia's first regional telemedicine company with operations in 7 countries across the region. Welcome. Also joined by Dr. Clive Tan, Assistant Chief Group Integrated Care, Population Health for National Healthcare Group. Dr. Tan is a medical doctor and public health specialist with close to 2 decades of clinical and leadership experience in the healthcare sector. In his current role, he's responsible for strategic planning for integrated care and population health efforts for more than 1.5 million residents in the central north region of Singapore. So, welcome. And then also not forgetting Dr. Tanthuwanit, EY Parthenon partner, Health Ernst & Young. Num previously was the Group CEO of Omni Hospitals, overseeing 4 territory private hospitals in Indonesia. He was CEO and Medical Director of Bumrungrad International Hospital, one of the largest private healthcare facilities in Southeast Asia, catering to international medical tourists. So welcome, Num, and join us virtually. So before I start, I think we could all recognize that the healthcare industry has undergone an accelerated digital transformation, really sparked by COVID-19. And as a result, decentralisation of healthcare has been empowered by technological developments and really increasing patient-centricity, personalization, and what we're going to talk about today, accessibility of health services. I think the advancement of portable medical technologies, diagnostics, and really improved access to precision diagnostics and screening outside of hospitals in rural areas. But then also the use of software, integration with mobile phones, telemedicine. It's also completely changed the way that care is delivered and both enhanced the ease and accessibility with, I guess, without lowering the high standards and quality of treatment. So in this session, we'll really start to explore how digital innovations and technologies can help bridge the access gap by improving patient centricity, accessibility to care, and more importantly, giving patients and consumers greater autonomy over their own health in a safe and secure manner. So with that, I think we'll jump straight into it. You know, I mentioned that digital technologies are really changing how patients get access to healthcare. I'd like to start with you, Snehal. Maybe you can kick us off. Share a little bit about your work with MyDoc, and then also maybe some observations of how the digital health model is transforming the current landscape.
Thank you so much, and it's a pleasure to be on stage and to sort of share some of our insights and work over the last several years when it comes to how digital transformation has changed fundamentally the delivery of healthcare. So yeah, I think when MyDoc was formed, there was really no such thing as telemedicine. the idea of being able to deliver care remotely or digitally was really sort of a pipe dream, especially in this region where the infrastructure was just coming to bear. And I think you fast forward, the several years in between, obviously COVID being an accelerant, and I believe the model has shifted dramatically where the idea of being able to provide care in a convenient manner to consumers, and I use that word deliberately, consumers or patients, but when we become consumer-centric or patient-centric, they start to meld, has changed the way that as everyone in the ecosystem sort of thinks about care. So we now take it for granted that when a person needs sort of access to care, they're going to probably use an app of some sort. That'll help either reduce waiting times when they have to go to a physical facility, or even better than that, being able to provide a digital en route to getting access to care any time of the day, any time of the hour, or any hour of the night, and be able to get immediate sort of information when they need it at the time when they need it most. So I think that has really changed the game when it comes to Southeast Asia, and I see that transformation accelerating from this point forward.
Okay, very interesting. Maybe Clive, from your perspective, we've obviously heard from the private side, public healthcare. Maybe from a policy standpoint, how is digital transformation changing the availability of healthcare?
Thanks, Daniel. So I think that for, typically when we talk about innovation, we tend to say that the private sector tends to lead. But I think that for digital healthcare, actually, the public sector has done a great job also. So if we can just look back at COVID, right? There has been a lot of advancements in digital health, and everybody kind of had a shock orientation to digital health, right? Trace together apps, telemedicine, and getting information on your fingertips just through the health apps that the government has pushed out. For example, Health Hub, right? So I think that has dramatically changed people's awareness and also their expectations on what digital health is. Previously, it was just like a notion that you hear about it, but you don't really know it. But COVID has given everybody a first-hand taste of what digital can be. And that has actually changed people's consumption habits, right? And if we think about it, there's really two categories that we can use to explain this. One is information, availability of health information through the health apps in a way that's personalized. You are able to get your lab results, your blood tests, your X-ray reports through the digital app in a safe and secure manner. The second one is the expansion of digital health services. Previously, digital health and telemedicine services were only used by a few people, but now I would say that majority of the population had experience with doing their nasal swabs in front of a phone or seeing a doctor through their phone. So the services have really expanded, and I think that the public sector has done well in sort of leading the charge with all the digital health apps and programs that they put up. Yeah.
Okay, thank you. Thanks. Maybe we turn to you now, Num. Obviously, your background, a very extensive experience spanning clinical, operational, as well as strategic board roles within the healthcare sector. Maybe in your opinion, how can patients use digital technology to better control their own health? And then following on from that, what does that mean for healthcare organizations?
Yeah, thanks very much, Daniel, and it's a great honor to be on this panel with my esteemed colleagues. So just building on to what Dr. Snehal and Dr. Clive already said, I think, in my experience, certainly in the last decade, from running Bumrungrad Hospital, where we had, over 1 million medical tourists from all around the world coming to us, it was really the tyranny of distance that sort of prevented us from providing continuity of care from those patients. And then we started implementing some of these very primitive teleconference devices and platforms to follow up, for example, a patient who had a knee replacement in Bangkok, and then a 6-week follow-up with the orthopedic surgeon, back home in Dubai, for instance. So it started off, being a very a remote connectivity tool to follow up our patients. And it's amazing how far we've come just in the last 7 or 8 years in terms of the technology that Snehal was describing and Clive was describing. And the fact that the COVID, of course, everyone's realizes it was a great accelerant in terms of regulatory reforms as well, and also physician acceptance of using telehealth as a way of monitoring and connecting with their patients. I remember at the start of 2020 when I was in Indonesia, trying to put telehealth into place, meeting a lot of resistance from both the regulators in Indonesia. It just wasn't allowed, and then a lot of our physicians, of course, were kind of pushing this down the track and not really wanting to adopt it. But with COVID in March or April, those barriers came down, and we were able to very quickly push ahead with this. So apart from what's already been mentioned from a patient perspective, the comfort and convenience, increased access, and also the by default having access to their lab records, medical records, and then having these teleconsultations from the comfort of their own home, being able to get their families involved as well. And I think that creates sort of a stronger kind of sort of awareness for family members, taking advice directly from the doctor, and then having kind of shared access to the results from the records. Plus the doctor has the added benefit of seeing the patient in their home environment, looking at their social determinants, other factors that may affect the care of that patient as well. So I think it's going to be great for establish relationships already, with the primary care provider, and also for chronic disease management where there's a long-term relationship and there's better access and more frequent check-ins with either the specialist or the clinical nurse to kind of modify treatments rather than waiting 3 months in between visits. And for hospitals, I think now everyone realizes, 75% of hospitals in the US now provide this platform. It's a great way to stay connected with the patients and provide better patient care.
Thank you. It's amazing to see how things have evolved so rapidly. Maybe for you, Julian, do you think we are really arriving at a moment of truly personalized healthcare?
Thanks for the question. I would say that based on what my colleagues on the panel have described, I think we're already a long ways down that path of personalizing healthcare. I think, the ubiquity of smartphones and communication devices, does help us with those three tenets of healthcare: accessibility, equity, and quality. And I think everything that my colleagues have talked about already is demonstrated or described how the telemedicine services, the services that we're providing, the tools that governments have put in place, the way that providers have, necessity is the mother of all invention. Yep. So with the last few years, we're in lockdown, people can't get to care environments. I think having the healthcare in your pocket, the device, not necessarily having to have the smarts on device, but being able to access the services that have got those smarts, whether it's Trace Together, whether it's a telemedicine app, whether it's other kind of medical devices and diagnostic testing on cloud, has really opened that up. I mean, let me just give some examples. I think from a telemedicine perspective, organizations like MyDocs, other organizations hosted on AWS Cloud, like HaloDoc in Indonesia, Dr. AXA in Thailand, I think has given patients choice. It's enabled them to approach and get healthcare wherever they've needed it, as opposed to the traditional model of 4 walls and waiting. I think healthcare is the only environment where we still have a concept called a waiting room in a hospital. And I think most consumers and citizens out there now, you can do shopping online, you can order services online. So healthcare is kind of one of those last bastions. I think the other element is, when we kind of look at some of the ways that patients are now integrated into the care path, who have an ability to provide an opinion of their preferences. So whether it's an organization like Allium here in Singapore that provides aged care services, looking at customer preferences, resident preferences, I think we're a long way down that line now. But it's around how do we integrate all of that and make it, to what Dr. Clive said, how do we make that kind of holistic and end-to-end?
Okay, no, great points. And I think, look, we've been talking a lot about digital technologies and access to healthcare, but I think we'd be remiss if we didn't talk about infrastructure, like you mentioned, and then also the access side as well. So maybe back to you again, Num. Really, how does digital innovation in healthcare affect rural versus urban areas differently? And following on from that, how will greater patient access to technology change the way healthcare is delivered?
Yeah, of course. Just building on what Julian said about the access and equity. Of course, we all realise that unfortunately if you live in a rural area, you have much up to now much lesser access to primary care and specialist care. I think in the US the numbers are something like that. There's 1/3 less primary care physicians in rural areas compared to urban areas, and for specialists it's about 1/10. So, having the digital connectivity and ability to access primary care physicians and especially specialists if you have chronic disease or a need to, certainly, that goes a long way to providing more equitable access to care for people in rural areas. Of course, also for specialists, maybe sitting in an urban public hospital or a teaching hospital, to be able to not only provide direct care, but also to provide advice to primary care physicians and generalists in the rural setting by these connected devices. And we know that people in rural areas, they're perhaps more disadvantaged because they're more likely to have poorer health because of other social determinants. They're more likely to smoke, to have more risk-taking behaviours. So I think, this has really been a great leap forward in terms of providing more access and quality of care to them, increased efficiency, connectivity, more frequent follow-ups, ability to, see more specialists, have more supervision for their chronic disease management, and, help really close the care gaps between the urban and the rural populations.
Okay, thanks. Maybe over to you, Dr. Clive. Obviously, the white paper on health ESG was recently released in September. One of the 5 key features talks about the use of digital tools, enhancing healthcare IT infrastructure to improve data sharing and governance. I personally think this is a wonderful approach. It's what we do at Zuellig Pharma. I head up digital and data, so it's something that's very close to what I do. And really being able to improve or break down data silos, I guess, but make interoperability safe and compliant. Maybe you could share with us the government's perspective on the data collection and also monitoring for population health.
Yeah, thanks, Daniel. So I think just for some context, the Healthier SG, it's a government strategy for probably the next 10 years to improve healthcare in Singapore and to focus more on preventive health. So with that, actually, there is a very ambitious plan to have a better sense of the population's health through information sharing, right? So I think firstly is to improve data collection by having more GPs move to electronic medical records. So that, of course, is a big growth factor for the industry. But then after that, it's about connecting the data, right? Because if you have so much data, but it's not analyzed collectively, it's not shared, then it is a bit of a wasted opportunity. So I think a lot of people have heard about Healthier SG, but what perhaps is a bit lesser known is that there is going to be a health information bill that will accompany the Healthier SG strategy. And currently, the ministry is already in consultations with stakeholders on this information bill. And they do plan to have it out for consultation, public consultation next year. I think this would really open up the field. If we just look back a few years ago, there's a big talk on data protection, right? Cybersecurity incidents, and many countries in the region launching their own Personal Data Protection Act. It's been great for pushing cybersecurity, but actually it's hindered data sharing a lot. So in a way, having this health information bill acts a bit as a balancing beam to that Data Protection Act. So now people are they would be able to know the rules and the process for data sharing and be able to use that health information bill and act subsequently to balance with the personal data protection. And I think just to end off that, I think that it's really a great time to be doing this because at least in Singapore, we see that the trust factor has gone up a lot because of COVID, and people see that their information that they share is used for their good, is used for the population's good, and there isn't that whole big brother is watching you conversation happening, right? So I think that whole experience, that 2 years, have given the public a lot more trust that the government is a good custodian of their health information and is using the health information for their good. So I think with that and the Healthier SG movement moving in synergy, I think it will really open up a lot of doors for industry and also for tech companies in this space.
Brilliant. Fascinating. I'd love to see how this kind of evolves over the coming years. Maybe open to Julian and Snehal. Maybe if you have a different perspective, maybe we start with yourself, Julian.
Well, I think everything that Dr. Clive said and Dr. Nam said, I think is spot on. I think what we, part of the conversation today is around patient-centricity. Yep. But to what Dr. Clive mentioned about information gathering and information sharing, we mustn't forget that the providers in this equation, so the doctors and nurses and our allied health professionals, the end users of the system to help collect that data, we also need to be in a space where they're consulted and that the technologies that we put in place help them in their day-to-day job. Yep. So remove some of the administration and enable them to free up their time to do clinical consultation. I mean, one great example is in Victoria in Australia, they have a virtual emergency department system that they put in place, just launched recently, that uses a system by the clinician, a New Zealand company, that helps triage patients before they decide to come to hospital. And part of the rationale for that is really around offsetting the ambulance ramping that might be happening in some of those places, so that only the truly sick patients take up the time and energies of those clinicians. But more importantly, those that are dialing in have an ability to use that technology to be better triaged and be directed to a better service where they can still receive a good quality of treatment. So I think as part of this movement that we're doing, got to remember that actually these technologies should also be augmenting the workforce and helping them do their clinical activities as well.
Okay. And Snehal, maybe?
Yeah, I just wanted to add something to, I think Dr. Clive mentioned about, in terms of the infrastructure that's being built out to support sort of these transformations. And I think that's a really spot on point. One of the conversation points that I hear a lot about is really this focus on fragmentation of data, but then also around being patient-centric. In my opinion, I think one of the things that we tend to lose in the conversation is the fact that from a holistic perspective, we need to look at all of these pieces as one sort of holistic sort of framework. In other words, we look at this topic, which is health in your pocket. Yeah. The reality is when we started MyDoc, we realized that we wanted to bring this idea of digital health to the market as a sort of a first mover, but realizing that in the long term, digital health will no longer be a standalone product, right? It can't. It has to be integrated into the entire patient experience. And I believe that we are well past the point where that needs to be the actual discussion, and it needs to frame it. We were discussing in the green room, I guess, before this chat about how, I think Jillian and I were discussing about how the way that you position things, but the words you use, has a huge effect on the way that consumers could be providers, it could be the patient, actually either adopt the technology or reject it. And I think the challenge here, when the next stage will be patient engagement. That's the sort of the trillion-dollar question. All of these technologies are great, but in my opinion, if they are sort of orphaned or they're not actually integrated properly, and we change the lexicon to being this is the pathway that we look at. Some will be digital, some will be offline, some will be online, but to the patient, it's just one continuous flow. We'll continue to struggle to see where these technologies will how they will mature. And it's up to us in the industry to start to redefine that lexicon to make sure that we do come up with an integrated future that'll help sort of benefit patients going forward.
Okay, no, great points. And I think this kind of leads on to my next talk, which is really around we're doing all this transformation in healthcare, but obviously there's barriers and there's a number of hurdles to get over. Maybe to you, Julian, obviously your role with AWS as healthcare lead for Asia, Pacific and Japan, you must have seen quite a different landscapes that you've been across. Maybe what are some of the biggest barriers to digital healthcare transformation that you've seen and overcome?
Sure, thank you for that. We've kind of alluded to it already, but I think there's two probably major points. One is around data silos and interoperability. And I know in the last 3 years, many of the questions I've been asked in my role have been, I have all of this data or I've got all of these care settings. How do I get that information and get the insight out of it that allows me to do population health or care pathways or clinical decision support? And then once they potentially have that in a virtual environment, how can I ensure that apples and apples, the data that I look at is the same, so the interoperability question. So that's the first point. I think part of the challenge there is how can we use the technologies to enable clinicians and people in this industry of healthcare life sciences use the technology to do the heavy lifting of that sort of mapping so that they can focus on the science and the medicine. I think the second element is really around digital maturity. Not all people start at the same place, and not all people have a same endpoint. And it's acknowledging that a lot of our stakeholders that we work with don't necessarily are looking for a one-size-fits-all, but they want something that fits their transformation roadmap, their timelines, and getting to an endpoint that may not be quite as gold standard, but is more than good enough for where that environment is. So I think for me, past 3 years has always been about, you need to listen to me and understand what my problems are, so yeah, you can help me. And the second one is starting off with, I've got a lot of data, but what do I do with it and how can I use that?
Yeah, okay, no, great points. And maybe to Snehal, obviously with what you're doing with MyDoc, is there any kind of perceived barrier towards online and offline integration when we talk about digital transformation?
No, I think this goes to, I think, Dr. Clive's point earlier. I mean, and this is where the public sector is, in my opinion, has led. I made an interesting sort of observation, and I know that this was sort of in the cards when MOH rolled out the scheme, but during the peak of the pandemic, the MOH came out of the scheme, which basically said, if you have the disease, don't come straight to the hospital. We will pair you with a telemedicine provider that will provide you care in your home. Now, what was interesting, and I don't think it was actually written, or I haven't seen it been written as such, but clearly the idea behind that was we are going to transform 5.2 million bedroom, or actually less than that many bedrooms, into hospital beds. And if you think about the whole conversation around CapEx and how we actually build more utilization factors around hospital beds, et cetera, it was a brilliant, brilliant sort of insight. And I've used that as a lead into this idea around online to offline, which I think is a completely artificial distinction. And I often talk about Kaiser Permanente in California, which has been a leader when it comes to the integration of both, as we call, online and offline care. I believe it's 2016 or 2017 when the late former CEO actually published sort of a talking point where it was, I think it was 2016, where they passed more virtual visits in that year than physical visits. Now, mind you, there was no conversation on telemedicine as a separate product. It was just, this is how we take care of our patients. And I believe that's really the angle that we need to get to overall. And I don't think it's just a private sector approach. Healthcare has always been it's an industry where the public sector has to play a major role, both from the payment side, the reimbursement angle, as well as the provision of care. So being able to bring all this together, and I honestly don't, hopefully in 2 or 3 years, we're not talking about online, offline, we're talking about the line, right? And this is the line to get care. And, and I'll just wrap up by saying what I think, I agree with what Jillian is saying. We can do this in a staged model, right? Where the overall core proposition is the same. It can be the same in Singapore as it is in Malaysia or as it is in Vietnam. The last mile piece can be extremely tailored to local context, right? Because at the end of the day, you have to meet the patient for where they're at, both culturally, psychologically, et cetera. And I think you can do that, but use a common core, which creates a scalable model that can truly scale across these markets and sort of deal with very different patient populations.
Yeah. Thank you. You touched on a point about not just private and public, so maybe Dr. Clive, anything to add to that perspective?
Thank you so much. I just those are great points raised by Snehal, and I just wanted to say that the public sector has a lot to do with regards to leading in this space. I just want to put up that we want to move to digital first, but it's not digital only, right? I think that's a key distinction that people must feel, that if they want to come to a hospital, if they want to come to a clinic, they still can, but digital first, right? It's kind of in your pocket, at your fingertips, go digital first. And if the doctor or nurse sees that you do need to come to the clinic, then you can. You're not being denied services. I think that's the key point. And I think with that, the public sector has a big role to play in moving the narrative, right? Because there is a trust factor there, right? And when the government says something, I think everybody perks up and pays attention, both the patients, the families, and also the industry. Earlier, Nam also mentioned that there are a lot of regulatory barriers. So the private sector has tried to overcome the barriers on their own, but it's almost impossible. But when the government wants to move, it brings along with it all the regulatory changes that are important for us to do so. Because previously, if you can recall, before the pandemic, there were so many concerns about medical legal issues surrounding digital health and telemedicine. But now that the government sees this as imperative, actually a lot of these things have sort of faded away and the doors have opened. And now it's like the public sector and the private sector are both dancing in tandem. And I see this as a great move forward for the whole industry.
Thank you. And not forgetting you, Dr. Noma, any different perspective from yours, how you see it?
Yeah, no, I mean, I think it pretty much been covered. Just wanted to add from our perspective, we work with a lot of private hospital groups in the region. And of course, now everyone's accepting of the need that we need to be a hybrid kind of digital first model. The problem is that the infrastructure, I think Julian mentioned, the infrastructure in some of these private hospital groups is really lagging behind because just the investments weren't put in pre-pandemic because we were just pushing, business as usual as much as possible. So now we're doing a lot of work with groups of 15, 20 hospitals across multiple countries with 6 or 7 different legacy HIS in the EMR systems. So to be a truly integrated hospital group or platform, of course, a lot of investments and integration and change management has to go in, to ensure that these virtual care platforms that they want to continue treating their patients with, becomes truly integrated with their the information system so that the patient data is recorded properly and can be shared across the group. So I think, most hospital groups now realize that they have to bite the bullet and make that investment. But I think it's, it will set the whole kind of industry up very well going forwards once this is done.
Thank you. Look, we could talk about this all day. I know we're conscious of time and we have a lot of questions that are coming in. Maybe one final one, and I'll put this out to everybody, and whoever wants to go first can. Really, what have we learned from COVID-19? And what needs to be done to push the healthcare industry in Asia towards digital health, or push it further in digital health? I'll open. Anybody want to take the question?
I can go first. Thanks, Daniel. So I think that actually COVID-19 has done a lot of good in pushing the barriers and opening doors. I think there are 2 big challenges for us right now. I think Julian and Nam mentioned about equity. I think we do need to take the products that have worked and start to scale them across and scale them up to reach the underserved. I think that's one big thing. But for those that are sort of at the edge right now, to continue to push the boundaries. So we talked about healthcare information at your fingertips, healthcare information in your pocket. I want to push that further to say healthcare analytics and personalized information at your fingertips. So like Norm mentioned that companies are now looking into strengthening their healthcare apps. We need to push the app developers further to say, give me longitudinal data, charted, and with insights. Tell me all those information and what the patient needs to do, rather than just static lab results. I think if we can do that, that would really push the field further. And of course, we can't do that without good data sharing and longitudinal data. So that's where I think the whole industry needs to come together to move that collectively, like what Julian mentioned, about better data sharing and better interoperability. Yeah.
I'll go next.
Yeah.
Just to kind of add on Dr. Clive's point, I would say that what COVID-19 has been able to do, and to be a little bit controversial, has been able to expose the lie that oftentimes is covered by the regulatory state. And I say this as being one of the first movers in telemedicine, and Julie and I were just sharing war stories. When we started, everyone was saying, oh, we can't do that, or it's illegal, or this and that. We're like, well, the data seems to indicate in other markets it's not unsafe. However, there was a lot of entrenched interest sort of promoting a certain view. I think we are at extreme danger of that in healthcare. Yeah. Obviously, regulations exist to protect patients. We understand that. We agree with that. We in principle, think that is the right thing. But if we're not willing to, at times, actually question the assumptions that will go into those regulations and question whether those assumptions now are relevant, then we get kind of cut out. What COVID-19 did was, again, there's nothing like a crisis that helps sort of expose the need to move quickly and to sort of throw open the barriers. And what you found was that all this innovation was there. It was all bottled up, but it wasn't mass market yet because, well, you can't do this, you can't do that. So I think what I would encourage, and sort of building on Dr. Clive's point, is that we don't lose that ethos of let's question, let's keep pushing. Let's make sure that we're providing the best potential outcomes for our patients or providers, everyone in the ecosystem, but not hide behind regulations that may or may not make sense and may have, unfortunately, perverse incentives to still be around. So I think that's a harder, difficult question. I think Singapore in particular as a government is incredibly innovative. I think we need to make sure that regionally we can continue that sort of momentum.
Okay, thanks.
And I think maybe just to add on, I think it's there's a saying we have within AWS and Amazon, which is be flexible on your approach but firm on your vision. Yeah. And I think looking across what's been happening during COVID is many countries arrived at the same endpoint, but they arrived at it differently according to their capabilities, their assets and their needs. And I think one of the things that we within the organization, whether we're a technology provider or a services provider or actually the customer, is around how do we make sure we tailor what we need to do to support that and enable the clinicians to do the science and medicine whilst we take on the heavy lifting. Yeah. And I think I'll hand over to Nam now, but I think it's just a case of working together.
Yeah. Okay. Maybe Dr. Nam?
Yeah, absolutely. Just to build on those points, I think what Dr. Clive said about pushing the barriers and Snehal said about the perverse incentives and trying to align it. I think the Singapore government, I think in Healthier SG, really trying to use this connectivity and leveraging data analytics to keep the population healthy. So how do we try and align all the healthcare providers to really leverage this, the connectivity and the digital platform that they have with the patients to really promote healthy behaviours as well and promote population preventive health rather than just treating acute episodes and chronic diseases. So I think that's kind of the next challenge. How do we maximise this to keep everyone healthy together?
Okay, thank you. Thanks. Let me jump over to some of the questions. We have quite a lot that's come in, so it seems like it's been a very engaging conversation. Maybe first, we're all talking about this health in pocket and using your mobile, telehealth. But in the region that we're in, a lot of the people are not tech savvy. Some people don't even have smartphones. So what does the future of healthcare look like for those that are not quite as advanced or tech savvy? Maybe we start with you, Snehal, with what MyDoc's seen.
Yeah, I think, look, I mean, that's very much the case. And, fortunately or unfortunately, smartphone penetration continues to rocket. So I think that gap will start to really kind of subside over the next couple of years. But I mean, there's some phenomenal work that's being done by other companies, and not-for-profits that have actually started to crack the code when it comes to using simple feature phones to basically text messages. I think and I can't unfortunately name some of them, but there are several companies I know in sub-Saharan Africa that have made huge strides and actually having measurable population level outcome, sort of impact by using a very small, shared feature phone in a village and whatnot. So I don't think you need to have the latest and greatest sort of hardware to basically access these services. I think, again, it's incumbent upon the innovators in this ecosystem to come up with clever ways to basically work with the connectivity tools that we have. And there's some phenomenal examples of people being able to do that. So yeah, I don't think that's any reason for us to stop or continue to hold back.
Yeah, okay, that's good. Maybe from AWS perspective?
Yeah, I mean, I just wanted to echo what Snehal said. I think, technologies like SMS are one way to reach. In New York City, during their COVID kind of pandemic, they used a lot of SMS technologies to reach the more vulnerable, sending out messages, are you okay, what services do you need, and then just simple things like that. And I think the other aspect is looking at the delivery model. Yep. So even though the individual patient may not have a smartphone, within their community, or if it's a lay person like an ASHA worker in India, if you've got somebody that's able to go out to communities, rural communities and villages that does have that capability, you're almost deploying that as a satellite experience and being able to collect that. And then I think the other element is a lot of ways that we can communicate now don't necessarily depend on the technology, but maybe things around diagrams, infographics, videos, the ways that we consume media now. So I think it's multi-channel that we should be looking at, pretty much like what Dr. Clive said before. It's not the only channel, it's one of many, and then just kind of directing people to the right one.
Okay, great. Maybe for Dr. Clive, we spoke a lot about regulatory challenges, and one of the questions here is, one of the key issues digital players face is regulatory challenges, either because of regulation considerations that get in the way of these solutions, or because of lack of regulation which prevents officials from assessing what should or should not be allowed? What is the way forward that you would recommend, and how can we drive impactful conversations with governments to move the needle?
Yeah, thanks a lot. I think that's a very important question, because I mentioned earlier that there's a lot of data protection, right? So we do need a data sharing act to sort of counteract that and balance it out. What we see in the US and Europe is actually that's already happening, right? In a way, they are quite advanced in this. So I do urge us to sort of watch the Singapore story as it unfolds about this health information bill, because I think that whatever gets passed would be a sort of a good template to follow for other countries in the region. Yeah.
Okay, thank you. Maybe this one I'll throw it out to everyone to answer. We talk about digital transformation and how we're moving and how it's accelerated during COVID or because of COVID-19. But a question here, are we being bold and fast enough? For example, the digital and telemed triage reference recently was available in the UK through NHS Direct more than 20 years ago. We don't seem to have really moved on very fast, and a true novelty in approach in pharma has relatively seldom happened. I don't know, a little bit controversial. Maybe who wants to take that one?
Why don't I start on that one? I think we have to acknowledge, again, remember, digital maturity starts and ends, varies. And I think in some environments, like in the UK, movements in that digital space started a long time ago. Yeah. But I think we have to be culturally sensitive in the countries that we work in, that you can't force people to go down a certain road. They have to adopt it at their own pace, otherwise it might end up becoming a white elephant. So I think to that comment, completely understand, but I think look at who you're working with, look at who you're dealing with, look at the conditions and the problems you're hoping to kind of deliver care to, and then work backwards from that. Because again, one size doesn't fit all, and a model from a different country with different assets may not quite resonate. So I think we have to work from our starting point.
Okay. Any different perspectives?
No, not specifically for this. That's a different question.
Cool, thanks. Maybe to Dr. Num. We're speaking a lot about preventative solutions and integrated solutions. So is there a plan or prognosis for continued support and education to patients?
Yeah, so I think maybe I'll ask Dr. Clive to chime in here as well with the initiative for Healthier ESG. So I think definitely it's a great way once you have that relationship and connectivity to the patient via this digital, and you're collecting longitudinal data and have that kind of both accountability both ways, then that really sets you up well to have individualized preventive care plans and action plans, and plugging the patient into the available support systems in their communities, and then have that regular touch points and checkpoints and follow up. And it may not necessarily be a face-to-face, but it could be a automatic reminders, using digital therapeutics to encourage, to educate, to provide information. And then you have, like I said before, visibility into all the social surroundings around that individual patient and their family and caregivers. So you have multiple touch points as well, and multiple data points to ensure that they stay on the correct path towards a preventive, a healthier lifestyle, rather than just treating them in an acute, episodic fashion.
Thanks.
Not sure. Yeah.
No, great. Maybe Dr. Clive, how is the Healthier ESG, how is it received in Singapore itself? What's the feedback been?
I think the Healthier ESG has generated a lot of excitement in the whole health industry, because I think at least in this region, it is quite innovative and forward-looking. And I think that it unlocks a lot of possibilities for industry and also for providers for researchers, for example, if they have a lot of information now that's available to them, it sort of unlocks a lot of possibilities. But Daniel, do you mind if I come back to an earlier point about the issue of getting access to health apps and using smartphones and all that? I do feel that it's a very important trend because of two things. One is that access to smartphones is just a one-way trend. It's going to go up. So we kind of have to be ready for that when it eventually reaches 100%. So I think that's one. I think the other one is that in the region, we have to look at the issue of urban migration and reverse migration. So people go to the cities when they're young, right? And then it sort of hollows out the rural areas. So you're going to have a big challenge maintaining health teams in the rural areas just because the size has dropped. But secondly, then you have this reverse migration where people live in cities, and when they get old, they go back to the rural areas. And these are people that need the healthcare the most. And because of that hollowing out of rural areas, you get fewer doctors and nurses there. So actually, in that sense, the digital health imperative becomes stronger. And of course, with more internet access in these rural areas, we expect that access should not be an issue in the future. Yeah.
Thank you. Look, this has been a fascinating conversation. I think it's just really amazing to see what we've seen, how we've transformed, how digital transformation is kind of leading the way here in this area. Really, to end the session, let's end on a high note. Maybe a quick fire. What are your hopes, predictions for digital health in the next 3 to 5 years? 30 seconds.
I think basically just keeping the uptick of engagement, keeping the uptick of consumption. I think people getting more trust, and I think digital trust in the environment and using those applications is what we can hope for, and hopefully seeing more delivery of digital care.
I think we'll go from talking about digital healthcare to talking about healthcare, because it's just going to be part of the formula.
Okay, excellent. Dr. Clive?
For me, it's about challenging assumptions. I think we often assume that the older generation have issues with accessing digital health, but the pandemic has shown that it's not so. So do challenge our assumptions often.
Okay. And Dr. Nam?
Yep, truly exciting times, and to add to Dr. Snehal's point, we talk about healthcare, but also wellness care, leveraging the digital tools that we have.
Perfect. Thank you. And with that, I'd like to say thank you to my esteemed panelists. Thank you to Julian. Thank you to Snehal. Thank you to Dr. Clive and Dr. Nam. Thank you so much.
Thank you.
Great. Thank you, Daniel, and our panelists for this session. Based on the interviews I've done in my podcast series for Digital Health Today, I wholeheartedly agree with many of the comments made by our panel. I was particularly struck by one of the comments made around the fact that a responsibility that needs to take place in the industry is to move and change the narrative. It's important that as we think about and consider the role that we have in influencing industry and where we can go and where we can take things, that we consider the importance of storytelling and how that really shapes people's opinions and views. So now, before we head off to lunch, I have 2 reminders for everybody. First, please do share your feedback by scanning the QR code that's on the screen. And also, please remember to visit the virtual exhibition hall, which showcases the various solutions that Zuellig Pharma has to offer. As I said at the beginning of the session, you can access this by clicking the login button at the top of the Summit website and be directed to the virtual event lobby. So enjoy your lunch break. We'll be back again at 1:30 p.m. Singapore time. Please use the same Zoom link you used to access this session originally. And you can also leave the webinar running in the background. Have a great break and see you again at 1:30.